This is Dr. Garais, and this is MED104, Medical Terminology, Chapter 8. So let's go to modules. And then chapter 4, 5, 6, 7, 8. Blood and lymphatic. Okay, blood and lymphatic. So hematology, that is the study of blood, and immunology is the study of the immune system, which your lymphatic um, um, vessels are a part of. And everywhere there's blood, there's an artery and a vein. Arteries are tubes or vessels that go away from the heart. Veins are tubes or vessels that go towards the heart. And your lymphatic systems, or your lymphatic vessels, and they have to do with your immune system and also to do with um, bringing your immune system to where it needs to go in different parts of your body, and also taking away any extra fluid, and that excess fluid is called edema. um Three types of blood cells: erythrocytes, leukocytes, thrombocytes, red blood cells, white blood cells, and platelets. Red blood cells carry things, white blood cells are part of your immune system, and your platelets are clotting cells. We also have proteins dissolved in the plasma or the fluid portion of your blood, which are called immunoglobulins. Globulin means protein, immuno means immune system. The other globulin that we also learned was hemoglobulin, which is the blood protein in red blood cells that helps the erythrocytes or the red blood cells carry things. Anticoagulant is a substance that's the prefix anti, against coagulation or clot formation. Coagulopathy is a disease state or a disease process that deals with clots. Thrombocyte is your blood clot cell, and thrombosis is an abnormal clotting. And that's the thing that blocks up your arteries. And if it travels around your arteries, that's called an embolus. Hemolysis, breakdown of blood. Hematology, study of blood. We already went through the sites. Emia, blood condition of leuc, white blood cells. Leukocytes are, of course, white blood cells. Phlebotomy or venipuncture, which is tomy, to cut into phleb, vein. And venipuncture, what are we doing? We're puncturing a vein. And that's what we're doing when we get blood from your arm. Lymphatic system, we already talked about immunity. We also talked about how it collects excess fluid, and that excess fluid, if it gets out of hand, is called edema. Lymphadenitis, inflammation or infection of your lymph glands. Lymphoma, you have a tumor that's in your lymphatic system, and that tumor could be cancer, could be not cancer. But again, we have to go to pathology, and we have to go get a biopsy, and we send that biopsy to the Department of Pathology. Myelitis, inflammation or infection of your myelo or your bone marrow. Myelodysplasia, state or condition, IA, of myelo, your bone marrow is abnormally growing or has abnormal growth. Anemia, leukemia, we already went over leukemia, right? It is a blood cancer. Emia, blood condition of leuc. And anemia is a state or condition where it literally means no, a state or condition of no blood, but in real life it just means diminished blood, or penia, like leukopenia or erythrocytopenia. Tonsillitis, if I have an inflammation or infection of part of my lymphatic system, which is my tonsils, I have several of them in my throat and in my oral cavity, we can perform a tonsillectomy. Splenomegaly, that's when your spleen gets abnormally large, and if it gets too large, we have to perform a splenectomy. Thymoma, if the thymoma gets too large, we'll perform a thymectomy. Penia, cytopenia. So leukocytopenia is white blood cell, decrease of white blood cells. Erythrocytopenia, decrease of red blood cells, and thrombocytopenia, which is, of course, decrease of your platelet cells or your clotting cells. Okay. Ecchymosis and hematoma. Ecchymosis means bruising, abnormal condition of bruising. Hematoma is a common side effect of venipuncture, also known as phlebotomy. Oma means tumor. Hemat means blood. Hemophilia. Phili means to loving, state or condition of blood loving. Hemorrhage, abnormal flow of blood, or it's when the bleeding is too much. Petechia or petechiae, plural, is the little red dots that we talked about in class. Reperfusion means to introduce an organ to blood again. The prefix re means again, and perfuse is to is to make sure that um, the organ in question is has a lot of blood, or a good amount of blood. Here's some variations: lymphadenopathy, lymphedema. Remember, the edema is situation where there's way too much fluid where in my lymphatic system. Spinalgia, splenodynia, right? Splinalgia, splenodynia. Sorry, going a little bit too fast. That is pain in my spleen. CBC, complete blood count. We talked about this. Leukocytosis. Remember, too much cytosis, too little penia. Macrocytosis, microcytosis. That's large cells, small cells. Elliptocyte, spherocyte. Elliptocyte is like an oval type cell, and the spherocyte is a circular cell. Lymphadenopathy, splenomegaly, lymphedema, we already went over. Lymphangiogram. Gram is the actual recording of the lymph vessel, and vessels are angio. Erythrocytosis, oligocytemia, we already learned what oligo means, is progressively decreasing. Anisocytosis is the term aniso means uneven. So if you have anisocytosis, that means not all the cells are the same size. If you have anisocoria, that means your pupils are of different sizes. Macrocytosis, microcytosis, normocytosis or normocyte. Embolism, we already know the difference between an embolism and a thrombus. You could have a thromboembolism. It started off as a thrombus, now broke off, and now is an embolus. It's very bad. We can have medication that's thrombogenic, meaning that it'll promote clotting, and we also have thrombolytic medication that will promote the lysis or breakdown of the clotting cell. See, more of the same. Except down here, the reticulocyte, that means a immature red blood cell. If you have a lot of reticulocytes, that means you're probably going through hemolysis or breakdown of your blood. Hematopoiesis is the production of blood. Myelopoiesis is the production of bone marrow. It is the red marrow that forms blood in your bones, and that's formation of blood products is hematopoiesis. Pancytopenia versus polycythemia. Pancytopenia means what? All the three blood cells. Red blood cells, white blood cells, and platelets. Polycythemia means way too many of whatever cell in question. Here's some more variations on different words. Remember, ptosis means drooping. Okay? Ptosis alone means drooping of your eyelids, or you could have blepharotosis. Splenetosis is when your spleen is drooping down for some reason. Hyperplasia, state or condition of too much plas growth. Antibody versus antigen, remember, has to do with your immunity. The antigen is the thing that the glycoprotein code on cells that tells you if you're a good guy or a bad guy, or it can generate an immune response. Like, let's say for a pathogen, will generate what? A disease, and an antibody will take care of that disease. Hemoglobin we talked about, immunoglobulin we talked about, perfusion, hypoperfusion, reperfusion we talked about, lymphangiogram versus lymphangiography. We already should know those suffixes. Hematocrit, that is part of your CBC that is called H&H, which stands for hematocrit and hemoglobin. And the hematocrit is the ratio between the plasma and the formed elements, which means the ratio of the water fluid or the fluid portion of blood versus the dry portion of blood. And the hematocrit will tell about the hydration status of my patient, or if my patient's dehydrated or overly hydrated, which is in the case of edema. Phlebology, phlebotomist, phlebotomy, tomy, to cut into phleb, vein. If you did the procedure wrong, you could get phlebitis, inflammation or infection of your veins. Sphygmomanometer, easier way to call it, BP cuff. And again, more variations on a theme here. Anemia, there's some types here: aplastic, hemolytic, and iron deficiency. Of course, aplastic means A, prefix means no, plas means growth, right? But hemolytic anemia is where you have decrease in blood cells because they are lysing or breaking down, like in dengue or hemorrhagic fever or malaria. Coagulopathy, deep vein thrombosis, hypocoagulopathy. If you have a blockage, that's called ischemia. Remember, myocardial infarction. That infarction will lead to myocardial ischemia, or the blocking of blood vessels. Therefore, the blocking of oxygen to that area of that's in question. Autoimmune. The prefix auto means self. That's when your body attacks itself, and the classic example is systemic lupus erythematosus. Immunosuppression, that's what we can do with steroids that will suppress or lower your immune system on purpose. Or it could just be a side effect as well. Hypervolemia, hypovolemia, hyper, too much volume of fluid. And these words up here, blood vessel disorder, is not a common word. This is more common and more to understand these words down here. Hyperbilirubinemia. Emia, blood condition of hyper, too much, bilirubin. And bilirubin is the coloring of your urine and feces, and it's formed from the breakdown products of red blood cells. Hypercholesterolemia, state or condition of too much cholesterol in my blood. Hyperlipidemia, state or condition of too much lipid in my blood. Septicemia, state or condition of massive amounts of bacteria in my blood. That is never a good thing. Remember my cowboy story. And uremia, also known as azotemia, if you're what's called that? What am I talking about? If your nitrogenous waste gets backed up. Excuse me, it's kind of late and I'm a little bit sleepy. That's all right. We'll trudge on. Hepatosplenitis, inflammation, infection of not only your spleen, but your hepat or your liver. Hepatitis, inflammation of your liver. You guys know these suffixes. Lymphangiectasia. Lymphangitis is a more common term. Don't need to know lymphangiectasia. Osteomyelitis is inflammation, infection of the bone and the bone marrow. We talked about this other word, but myeloma is an oma, a tumor of your bone marrow, and you don't know if it's benign or malignant until you do biopsy, and then you can send the biopsy to the lovely department of pathology. Anticoagulant, a thrombolytic. We already went through that. Thrombo, blood clot. Lytic, lysis, to break down that blood clot. An anticoagulant means against clotting or against coagulation. Hemostatic, if you have a hemostat, which is a little clamp, right? It's a blood clamp. And what will it do? Ic pertaining to blood, and stasis means to stand in one place or to stand still. Laparosplenectomy, laparo means abdomen, spleen, of course, your spleen, lymphadenectomy, removal of your lymph glands, lymphadenopathy, lymphadenectomy to cut into, and you get the rest. Okay. Not good. Pheresis, not common, I meant. Means transfusion, right? Plasmapheresis, I'm transfusing plasma or the liquid portion of blood. Platelet pheresis is transfusion of platelets, also known as thrombopheresis. I don't understand why they didn't write the word thrombopheresis instead. Let's look at some abbreviations. CBC, complete blood count, hematocrit, hemoglobin. We don't use platelet too much. Red blood count, white blood count. If there were lowercase letters, it would be red blood cell and white blood cell. Erythrocyte sedimentation rate. You don't need to know what that is yet. But PT-PTT-INR is a platelet function test, and that's common. Bone marrow transplant, BMT. ALL, AML is acute, I forgot, lymphocytic, leukemia, I forgot the L, but AML is acute myelogenous leukemia, CML is chronic myelogenous leukemia, DIC is disseminated intravascular coagulation, and I don't know what these are. HUS, ITP, not familiar with those. IV, very important, intravenous, right? HIV, AIDS, EBV is Epstein-Barr virus. I don't know what HSM is, but LAD to me means left anterior descending artery or coronary artery. And with that, that is chapter 8. So thanks for playing along, and I'll post this and some questions shortly.